Thank you for joining us. We'll start shortly. Good morning or good afternoon, depending on where you are. My name is Joy Moses, and I'm joined by my colleague, Jackie Gardner, for today's webinar focused on the Alliance's series of surveys, which we call Voices from the Field, that highlight issues that are impacting people experiencing homelessness and service providers and systems during COVID-19, and which is basically these very unusual times we're living through. We are going to go over some information about our surveys, and I'm going to actually at this point turn the floor over to Jackie to start off the conversation. Jackie?
Thank you, Joy. I'm going to just share my screen and we will get started. All right. So again, I echo Joy's statement. Thank you for joining us. We are going to jump right in. As Joy said, we are the presenters today. Joy is the director of the Homelessness Research Institute, and I'm a research associate on the team. So some quick housekeeping. If you have questions for either of us, please use the Q&A feature to ask those questions. And we encourage you to use the chat feature so that you can have conversations amongst yourself during the presentation. But be sure you're sending it to all panelists and attendees, otherwise it just comes to us and no one else sees your message. And then I just wanted to remind everyone that, as always, we're recording our webinars and it will be sent out to all of our registrants and posted on our website like usual. And you'll notice we have a pretty short agenda today, and the reason for that is we want to go over all of the findings with you, but also we'd like to hear from you. So we're encouraging you to use the chat functions so that we can hear about what's happening in your communities, or you can talk to each other and learn from what's happening in places that differ from yours. So a quick overview. Back in April of 2020, NAEH, the National Alliance to End Homelessness, started conducting surveys of COCs because we wanted to understand the impacts of COVID-19 and how communities were responding. And this project has actually been a continuous effort through the pandemic. So there's actually 3 previous survey efforts, and the results are all on our website at that link. And again, we'll send the slides out along with the video so you have all of these links. And like the earlier surveys, the 4th round of surveys focused on things like health, housing resources, and other topics related to the pandemic. But new for this round was an additional survey outreach effort to service providers and advocates. And that was done so that we could get some additional input from the communities to see, you know, how it was for, you know, people doing frontline service and people, you know, doing advocacy efforts at the local level. Like, you know, what has this pandemic caused, you know, to happen for them? And we got some very interesting and valuable information from that as well. So I'll go over the methodology of the surveys and then we'll jump right into the results. Basically, what we did was sent an email to all of the COC contacts listed on the Department of Housing and Urban Development's grant contact page. We sent it out on the 23rd of February with a deadline for completion of March 5th. And we used SurveyMonkey as we do for all of our surveys. And we actually decided this time we were going to send out personal emails to 2 groups. One of those was groups who had responded to one of the first 3 surveys, but not the 4th survey, or contacts who never responded to any of the previous surveys. And we collected those responses through the 31st of March of this year. And after removing duplicates and empty records, we had 147 unique COCs represented, which is 37.5% of all of the COCs, and the completion rate was about 50%. The service provider and advocate survey had a similar process. We invited them to complete a survey through our Alliance weekly newsletter. We asked that people complete their surveys by March 16th, but then we extended the deadline to March 19th. We had a total of 630 responses, but some didn't qualify because they identified as something other than a service provider or advocate. And of those 566 qualified responses, 113 were from advocates and the remaining 453 were from service providers. And we actually received responses from all across the country and the US territories, everywhere except for a representative from the state of Mississippi. And with that, I would like to turn it over to Joy to talk about the areas we focused on and what the results showed.
So please pardon the brief transition period. And I will go ahead and continue the presentation. So basically, we asked the various participants in our survey questions in a limited number of areas or a defined list of areas. Those included consumer health, crisis response housing, permanent housing, unsheltered homelessness, resources, staffing, and we grouped together advocate insights as its own category because it was very enlightening and summarized a lot of what we needed to know, or summarized a lot of what we needed to know about what was going on in the field. So of course, when we're in the middle of a pandemic and a large-scale health crisis, one of the first things we want to know is about health. As we began this survey in the end of February and into March, obviously vaccinations were and are a big concern. They had become available, and everyone was thinking about how are we going to make sure that people experiencing homelessness are able to participate in this broad vaccination program. So there were, again, some sub areas that we were concerned about. Priorities, plans, tracking, and implementation. The first one is priorities. The CDC had recommended, or I should say the CDC had suggested the possibility of prioritizing people experiencing homelessness within vaccination plans of states and local areas. The Kaiser Family Foundation has been tracking which states and how many states did so. So according to their information, it was roughly half the states. We, in our survey, asked our COCs, how many of you or which of you have a prioritization in some way for people experiencing homelessness that applies to your state or your local area. 56% said that they did. A lot of these were tied to shelter and concerns about congregate shelter. So that might have put some limitations on which members of the which homeless consumers were prioritized. We next asked about plans, if COCs had plans in place or were a part of plans to conduct mass vaccinations of people experiencing homelessness. At that time, there were 49% that said they did. We anticipate that as time went on, more of those may have come into existence as we got further along in the vaccination process. We were curious about how many COCs were going to track who was vaccinated and how many people were vaccinated. We discovered that number was less than half. We were curious about how this was going to affect the way the information available and public health decisions if people didn't necessarily know how many people experiencing homelessness had been vaccinated and where they were and who they were. So that still is a little bit of a concern, but obviously there were some barriers there related to whether or not there was data integration that had happened in those places, whether or not systems were basically sharing information. It's often difficult to, in an ad hoc basis, start sharing with a system that has medical information. But we did hear that some COCs were looking into self-report information or had other ways of tracking. The next issue we looked at was implementation, and this was a category of questions that we asked of service providers. And by service providers, we mean shelter providers, rapid rehousing providers, coordinated entry folks. We asked them if some of their clients or the people who were coming through their doors had been vaccinated already. Again, this is a defined time period, late February, March. Actually, for service providers, it was during the month of March. At this stage, 61% said that they had people who had already started getting vaccinations, which we found to be very encouraging because we were still in the early stages of the national process of getting everybody shots. So we, as I said, we were encouraged by that, and we had some additional questions for service providers, mainly about the roles that they were playing in the process. That would be reflected in the chart off to the right. We heard a lot of encouraging things. Again, that the vast majority of service providers were educating clients about vaccinations. A huge number, 57%, said that they were providing space for vaccinations. So hopefully that was easing the process if people providing shots were coming to locations where people experiencing homelessness live or get services. So we were hopeful that the process went smoothly in many places throughout the country. The other thing that we were curious about is just the nature of COVID-19 cases. There is information that is available that I like to point to that the National Healthcare for the Homeless Council is regularly updating. They provide information on how many people coming into their health centers have been vaccinated or tested positive. They also track testing events, so any sort of wide-scale testing of a shelter or a community, etc. That information is very informative, but we also wanted to kind of get a sense of how many of the service providers that we were able to reach said that that their clients were impacted by the crisis, and that was a significant number. 76% reported that they had, some clients or at least one client that had tested positive for COVID, which suggested that that this was a very real issue that people were dealing with as providers, in addition to what was going on in the overall nation. A little more than 1 in 4 had experienced some breakout amongst their clients. So that is something that became a much bigger issue for them than 1 or 2 people testing positive. A big issue that we have identified throughout the various parts of this series is the crisis response housing. It was the most common way that systems reacted and altered the course of business in order to respond to the pandemic. The vast majority in every survey that we have done have said that they had some sort of non-congregate housing program, largely hotels and motels that they were able to newly commission. We have been curious as time has gone on of how many of those programs are still up and running. We asked this question at the end of last year, and we asked it again as a part of this survey. And 79% of COCs said, yes, we have our of the ones who had a program, they said that they were still up and running. Big reasons that they attributed this continuance were, of course, that the funding is still available. That is what allows us to do our work. And then they also said, obviously, there is a big focus on preventing the spread of COVID within their COCs, and that hotels and motels are a big part of that effort. There were a limited number of COCs who had ended the programs and had stopped their non-congregate shelter in whole or in part. And again, we asked why. A big response was in the form of a limited number of COVID-19 cases, either amongst the people experiencing homelessness or just in the community generally. And some cited funding limitations. We were a little concerned about this, or we just wondered about responding to limited case numbers by ending hotel motel programs. There has been some research in various forms. There's research on congregate shelters that suggests that once the virus is introduced in those environments, it can become widespread. And then researchers at the University of Washington who have appeared in one of our previous webinars found that that people who were in hotels and motels were less likely to contract the virus than those who were not. So ideally, the research would suggest that you would keep those beds open in order to continue to have a limited number of cases. But we did have some people saying that the limited number of cases drove the end of the programs. One of the other things that we have been curious about is how many people experiencing homelessness have been able to access these non-congregate shelter beds. At various stages in the process, we have seen some evidence that suggests that it's a limited number. In our early surveys, in our first survey, we asked how many such beds have been created. At a later point, we asked for some data collection from some COCs who volunteered that information. And in this latest survey, we asked again, how many beds have you added in this category? And essentially, when we asked how many beds were added in the category between the 2020 HIC and the 2021 HIC, which is done in January of each year, we saw that, yes, there was a dramatic growth in non-congregate shelter. As we can see here, it was 148% growth, more than any other category of housing during that time period. But we also noted that the increases amounted to a small number of beds for the COCs who responded to these questions. So again, we felt like there is probably a small slice of people experiencing homelessness who've accessed these resources. And we've seen that in this survey, previous surveys, and in our previous data collection. Again, we were wondering if that resource should have been used more expansively, given what we know from the research on the effectiveness of non-congregate shelter in preventing the spread of the virus. In relation to crisis response housing, earlier in this Earlier in the year, the federal government announced that FEMA would be offering a more expansive reimbursement for non-congregate shelter for basically for a number of hotel and motel rooms across the country, which does provide an avenue for increasing the availability of those beds. But we learned that only 47% of our COC respondents anticipated that they would be participating in this offer. We're curious about some of the reasons that people would have for those types of decisions, or systems would have for those types of decisions. We asked it in a general way and also in an open-ended way, and what's off to the right is some of the responses that we got back from participants. Some of them indicated that they were not a part of the decision-making process about using the FEMA funds, that there were other state or county government officials who were making those decisions. They talked about perception that the programs were not needed. They cited bureaucratic concerns, how quickly they would be reimbursed, the reporting requirements. They talked about insufficient staffing to manage the scale up of that type of new housing. And a big issue that is definitely external to systems is that motels and hotels just didn't want to serve some of their clients, which is a big barrier. Some were using other funding sources. We know from our previous surveys and this one that a lot of COCs were using CARES Act funds for their hotels and motel rooms, and they may have been using other funding streams as well. And there were some people who still didn't have enough information about the changes in policy or how to apply. As homeless advocates and as homeless service providers, a lot of us tend to be focused on permanent housing and making sure that people are not homeless. So luckily, or happily, I should say, we noted that every group that we surveyed gave us some responses that indicated that permanent housing was critical to them and that they had it on their mind, and it was a part of their plans and what they thought was necessary for the people they serve. So we heard this in some form or fashion from COCs, service providers, and advocates. When we asked the COCs about how they had spent the CARES Act funds, which were a part of legislation in early 2020, 76% of them said they had spent at least some of that money on more permanent housing beds. We were curious about, again, as I mentioned, we asked about growths in the different types of housing over the course of the crisis, based on looking at the HIC changes, and that's, I'm sorry, I should spell that out, the housing inventory count changes. And essentially, we found that there was a growth of 7% in the PSH category, and 16% in the rapid rehousing category for the respondents who gave us their bed count numbers. But we were curious, and we noted that there's been a lot of conversation about people in housing, in non-congregate shelter housing that resulted from the emergency. A lot of that housing was dedicated to older adults or people with disabilities or illnesses. Some of it was used for shelter decompression. We were curious what happens to people when they leave those temporary housing situations, And we asked our COC representatives to make estimations of where they go. And they estimated that 42% of people who leave hotels and motels for permanent housing, which means that most don't. A lot of they believe that I'm sorry, yeah, which means most don't. They believe a lot of people leave for congregate shelter, or they are unsheltered or doubled up, or a big category is just unknown. They don't know what happened to them. An additional category we looked at was unsheltered homelessness. This is definitely going to be a big area as we move into the future. It was a big area as we were going into the crisis. When there was a pit count taken in right before COVID, and the national emergency was declared in March of 2020, the nation did a pit count in January, just a couple of weeks before that. And at that time, we had already noted that there was a 7% increase in unsheltered homelessness over the previous year. Since that pre-COVID period, we asked COCs if they had any reason to believe that there were growths in unsheltered homelessness since then, and that 47% said yes. So that is a concern. That is definitely a concern that the population may be growing, that COCs believe that the unsheltered population is growing. One difficulty that is associated with this is that the typical procedures for counting the group have been disrupted. As we started the January 2021 PIT, which is, of course, earlier this year, the pandemic was clearly going to interfere with the process that involved a lot of volunteers going into the field, or a lot of workers going into the field and having one-on-one conversations with people, going to trainings for that process in small and big rooms with a lot of other people. So HUD did issue guidance about making adjustments to the process. We asked our survey respondents, what did they do for the 2021 PIT? Roughly 1 in 3 said they didn't do a count of unsheltered people at all. And of the remaining participants, 85% said that they had altered their methodology in some way. So as we are basically in a recession and in a period where unsheltered homelessness may be growing, we definitely hit a roadblock in effectively measuring that particular problem in the same ways that we are accustomed to. There has been a lot of conversation from HUD and from the Alliance and others about finding other ways to keep track of this group. And we asked our participants how they were doing that. They listed they gave us a number of responses. A large number of them, as you can see off to the right, were already tracking unsheltered people in HMIS throughout the year. Similar to that, there were participants that had by name lists. And then we heard of other useful approaches, including looking at drop-in center data regularly. Someone mentioned encampment mapping. A couple of people have talked about doing mini pit counts at different times of the year to continue to understand how the population is shifting. And then there was a mention of vehicle counts as well. Another area that we tend to spend a lot of time on, because we want to make sure that COCs and providers have the resources that they need to do their work, is money. So we are curious about how people are spending their money, how much money they need, etc. I mentioned the CARES Act earlier. That was passed in the beginning part at the very beginning of the crisis, early in 2020. It did direct $4 billion to the Emergency Solutions Grant Program. We were curious about how COCs were spending that money. 41% said they still had some unspent and unobligated funds. And then we were curious of the funds that had been spent and obligated and so forth. How did they use them? And it was quite clear, as you can see on this chart, that they used these funds for a variety of needs. Top among them was staffing, the previously mentioned hotel and motel rooms for non-congregate sheltering, permanent housing, PPE, resources for encampments. So the money was in the field and doing a lot of good. We believe that some are also directing resources towards long-term goals and doing long-term planning with some of the remaining funds. Since the CARES Act of 2020, there has been new relief legislation that was passed earlier this year in 2021, the American Rescue Plan Act. The funds are directed within that legislation to various programs that could impact housing instability and homelessness. But it's notable that the funds are not flowing directly to homeless services programs. They may be engaged and hopefully and should be engaged in efforts to spend down those funds and use those resources, including providing people and families with housing vouchers and eviction prevention services, et cetera. And we're hoping that coordination happens, but we suspect that it's hard for providers and for systems to completely predict what the impacts will be when they're not directly connected to those resources. We were curious about, again, our direct service providers, the shelters and others, how they in particular were faring. Basically, 1 in 4 of them told us that they had lower than typical fundraising outcomes, which is probably not, which is, something that may be not too surprising during a recession of this type. 35% of the providers said that the increased demand for their services is outstripping any new funds that they have received. As mentioned, there are new funds flowing through communities, but there's also an increased demand, and for many, it's not balancing out. We were curious we asked an open-ended question about the challenges they were facing. Of course, there are some nonprofits that rely on fundraising events each year. Some of those obviously had to be canceled if they were in-person events. So that could have put a dent in some people's fundraising efforts. They talked about decreases in state and local revenues, leading to cutbacks in contracted services with agencies. Relatedly, reduced income from billable services. And then, of course, they had new expenses. They needed PPE and hazard pay. They may have needed new employees, all sorts of things associated with the crisis that required new resources. And then I think with the unusual circumstances and the unusual funding streams, they were trying to manage the future funding uncertainties and how they should think about next month or next year. Another area that we have been curious about throughout the course of this project is staffing. This is our 4th survey of COCs. Each time we have seen huge margins of people expressing that they're funding, not funding, staffing shortages in their systems. They point to frontline shelter staff, case managers, and street outreach workers as being particularly affected. They don't have enough of these people, and they express that this is at least in part due to the crisis. At various points, we've asked about the kinds of challenges that these workers face, and we have seen again a significant responses related to increased stress, exhaustion, and just general decreased morale during unusual circumstances. There's been conversation by our organization and others about how do we support workers to make sure that they continue in their employment, that they're still able to do the best work possible. And our respondents talked about a lot of things that they were trying to do to make sure that their workers felt appreciated and that they were able to continue to serve others. Those things included, of course, at-home work options, which a lot of us are familiar with, and work schedule adjustments. But there was also a mention of financial incentives. That was 35% of our respondents. This could take the form of hazard pay or bonuses. They talked about paid leave, 30% of those responding. And then they talked about other like useful tools that just can help employees who are going through tough days. And these include appreciation events, employer provided lunches, and virtual exercise and wellness activities and team building activities. I sort of previewed and mentioned at the beginning that we were particularly curious about the things that advocates in communities would highlight and how they would summarize the homeless services system and provider response to the pandemic. And these two charts represent what they said. So we believe that there is some division between communities and just what is happening in the field. But I pulled out the top 3 responses in each category. The first category being, we asked advocates, basically what is working really well in your community? And from your point of view as an advocate. And the top 3 things they cited were street outreach, reaching out to unsheltered people, and the vaccination planning and delivery. In addition to asking about the successes that they saw, we asked about, well, what appear to be the biggest challenge areas. And then we saw a somewhat overlapping list. Vaccination planning and delivery. Again, we must point out that this was a little earlier in the vaccination process, and for some people answering, it was in March, at various points in March, but some people identified the top choice was vaccination planning and delivery as a challenge. And then number 2, the familiar need for more permanent housing. And then 3, as with the success list, some perceive the reaching and serving unsheltered people as a particular challenge. So it's likely that that the answers vary depending on what community you were in. Some are doing well at various parts of their response. Some were experiencing challenges in those same overlapping areas. But it was helpful to filling out our knowledge of the types of things that were going on in the field. And the last thing I'll mention is the big thank you to anyone who is was participating in this webinar or who hears this webinar, we definitely appreciated those of you who contributed your responses. As we mentioned at the top and throughout, we reached out to a significant number of COC representatives, direct service providers, and advocates, and we received an overwhelming response, and it was very helpful, and not only in our understanding, but the community's understanding of some big picture trends occurring within homelessness. It definitely can serve as a way to understand how individual communities or states experiences compare to others. It can point to places where we could all learn more about how to better serve clients, and it can definitely influence the way policymakers think about this issue, the resources they direct towards it, and how they can otherwise shape the response and the aftermath of the response. So hopefully we're headed into a post-crisis period, and it's good to know where we stand as we're doing that. So we wholeheartedly thank everyone who participated, and it's worth saying over and over again. So we wanted to highlight that. There's just a couple of little details here or housekeeping information. This is the contact information for the two of us. And here are also the links to the previous surveys and the previous materials, as well as information about the Alliance's Center for Learning. If there are any questions, we can take a few. If we want to have a little bit of discussion, we have a few minutes for that. We're nearing the time. We did want to make sure that we were doing a brief overview and not a time extensive a program that involved extensive amounts of time. But we just wanted to get some of the highlights out to you in another form. So
I'm not seeing any questions yet. So if you have questions, please put them in the questions and answers box. And if you want to send them to everyone so that they can see your question, you can do it in the chat, sending it to all panelists and attendees.
And I'll also say to those of you who are participating live or looking at a recording, you can conveniently use this slide that we're on to email us any additional questions, and to further engage with us around this project and the results of this project. We definitely appreciate you joining us today, and we look forward to continuing the conversation tomorrow, and hopefully not too much further into tomorrow in relation to COVID, but other issues. Have a good rest of your day.
Thanks, everyone.